I'm Dr. Michaeli. I'm a peripheral nerve surgeon. We're going to talk about pronator syndrome. Pronator syndrome presents a lot like carpal tunnel syndrome, and it's often missed by clinicians that don't do hand surgery. Basically, you have the median nerve. So, if you imagine, they kind of start off in your neck. It starts up around here, goes all the way down. Around this area right here, you have something called the ligament of Struthers, and sometimes in a rare percent, figure anywhere from 1 to 10% of patients with median neuropathy, it's not just carpal tunnel, but there's also a constriction here. So there's a ligament of Struthers, so we make a little incision to release that. A little bit more distal, you have the bicipital aponeurosis, also called the lacertus fibrosis. So essentially, you just make a little incision, we release the lacertus, and then lastly, deep to that, we have the deep head of the pronator teres. And what that does is that turns your hand this way. And that's going to be very relevant for the discussion of our symptoms, how they might differ a little bit. So we release that tendon, sometimes we lengthen it a little bit. Now, how might you notice your symptoms being different? A lot of times you have pronator syndrome at the same time as carpal tunnel? Well, it's when you're pronating. So if you have symptoms while you're brushing your hair, or maybe you're using a blow dryer, you're driving on the steering wheel, that will aggravate the symptoms because your pronator's activated and it's pushing on that nerve. So by releasing it, we're actually freeing up the nerve, giving it a chance to get more blood flow and allowing it to heal. After surgery, while you shouldn't be in a whole ton of pain, the incision will cross a joint surface when I do it. So I do recommend that we still continue moving. We don't want things to get stuck. There's always a small risk that there might be a little bit of wound breakdown, but we take that risk because we can always revise that scar later, but we want to make sure that the nerve is extra healthy.